Doctors of Reddit, what's your best they came in for a small checkup and ended up needing surgery story? I went to my doctor thinking I had a bladder infection. I felt like I had to pee every 5 minutes. Doctor found nothing but sent me for an ultrasound. Turns out I had a cyst the size of a grapefruit on one of my ovaries that was resting on my bladder. 5 days later I was in the hospital having my ovary removed. Not a doctor, but I worked in an emergency room in nursing school. I was sitting out in Tridge late one night. My nurse had ran to the back for a minute and a guy comes in. Only complaint was a sore throat. Nothing else at all. Just a sore throat. But something was off. He had a slight grayish tone. As a tech, I figured why the hell not. Told him to follow me and took him to our electrocardiogram area. Few minutes later, my nurse comes back and is looking at me like I'm nuts because I'm doing an EKG on a sore throat. I handed her the printout and she had a no damn look. He was having a STEMI, massive heart attack. My charge nurse came out later after the dust had settled and asked me what made me check him. I told her I didn't know, he just didn't look right. Intuition can be a funny thing. Poor guy, he was slightly confused about the whole thing. He just wanted something to fix his throat irritation. I had pretty intense tummy pain and googled it. Google overwhelmingly said appendicitis. Went to the doctor, told her I had appendicitis. She kind of laughed at me and told me I would be in much more pain if that were true. Then she poked where my appendix was and basically said, and it would hurt right there. Which it did, a lot, even more so when she poked it. I pushed for an ultrasound and less than an hour later was going into surgery to have my appendix removed. Google is as accurate as you make it. I am the patient. I work construction for a living and was working a job removing some very heavy laminated glass. Strenuous lifting all day long. During the course of the gig, my left testicle began to swell and hurt and wasn't getting any better. I told my supervisor I suspected I had given myself a hernia, not unheard of in my field, and went to the occupational healthcare clinic in town. The sweetest grown motherly physician did the whole turn your head and cough deal. Awkward, necessary, but yielded nothing. She recommends I check myself into the emergency room and get an ultrasound. Well, when the ultrasound tech finished the session by saying good luck to you, buddy, I suspected something amiss. Well, one removed testicle, a round of chemotherapy, and an abdominal lymph node removal later, testicular cancer hasn't beaten me down. I'm awaiting my 4-month post-surgery CAT scan now. Fellas, check ya nuts. I was playing in an out-of-town sports tournament, and during a game I got hit in the ribs. The pain was so bad, I went to the hospital, thinking it was a broken rib, and they would give me some 600 mg ibuprofens. After an x-ray they saw it was a pneumothorax, collapsed lung. Well, I did not understand what was wrong at first. They explained there was an air bubble outside my lung, and I didn't think to Google the medical name. I just thought, that doesn't sound so bad. So when the doctor told me I probably need an operation and stay 5 nights in the hospital, I was like, what? But I'm going home tomorrow? The doctor said I can go if I really want, but I have to sign this paperwork, and that was the first time I understood this is actually a serious injury. Luckily I live in Germany, so I wasn't worried about going bankrupt. But in my case I just didn't understand how dangerous the situation could be. One-sided, I quickly agreed to stay. Actually a doctor, pediatrician, so many stories. Teenager comes in for ear pain and turns out there is a hornet stuck in the ear biting the crap out of his canal and eardrum. Had to have it surgically repaired. Kid comes into ER for cough for a couple weeks. Parents are very worried, and the kid looks off, so I order a chest x-ray. His mediastinum, the white part between the lungs, takes up almost the entirety of his chest. Massive tumor. Kid with belly pain and vomiting for 12 hours. Belly exam is hard, not like she is flexing, but like rigid as a board. Ultrasound for appendicitis shows a massive kidney tumor that went from right lung to bottom of the right pelvis. Women's tumors are crazy. Most recently had a little one in for a regular checkup that parents had kept postponing. Kid can't sit up alone and parents still have to feed. Not normal for a 9-month. Ultrasound of the head shows too much water in the brain and the kid gets surgery within 24 hours. Not a doctor, but a paramedic of Reddit. When I was a brand new medic, we got a call Sunday morning for a 20-something-year-old male vomiting, with a small amount of blood in the vomit. I speak 2 languages. My partner at the time was from a former Soviet bloc country and spoke about 5 fluently. Believe me when I say this guy got cursed out the entire ride to his house in 7 languages. A 20-something-year-old called because he was throwing up on a Sunday morning. Dude, you have a hangover FFS. We arrive and are met downstairs by his girlfriend who is panicking and confirms they went out drinking the night before. We roll our eyes, grab our gear and head upstairs. As soon as we see the patient our tone changes. Guy is Asian, but is paler than printer paper, soaked with sweat, is cold when I touch him, and is barely conscious. I look next to his bed and a small amount of blood in the vomit is in reality a medium-sized garbage can, almost 1/4 full of straight blood. His blood pressure is low, around 70/30. His heart rate is compensating by beating at about 160 times per minute. We get a big fourth in him and replace about a liter of fluid. His vitals improve. He comes around enough to answer questions. He says he drank 2 beers last night and smoked some pot. He says he has never been able to have more than a few beers without getting sick for days. I ask about his medical history and he says he has had general digestive issues his whole life, but never anything like this, just has to have a low-fat diet or else horrific diarrhea, bad hemorrhoids, low-grade abdominal pain constantly. But has never been given a clear diagnosis. Nothing on paper to go from. We get him to the hospital and drop him off in critical. In one of my only true Dr. House moments, as I'm walking out I tell the trig nurse exactly what the issue is. From the deepest depth of a half-slept through lecture during paramedic school, I remember all these symptoms. He has an undiagnosed liver issue, which is causing blood flow through his liver to get backed up. When the liver doesn't work properly, you can't digest alcohol or fat effectively. When blood starts backing up it causes portal hypertension, which causes hemorrhoids, and basically hemorrhoids in the esophagus, called esophageal varices. One of these varices has popped, and he was bleeding out through his esophagus. One of the only times I have correctly diagnosed a problem beyond hey this drunk guy has been drinking alcohol. I was a patient. I got into a 60 miles per hour motorcycle accident a year ago. I slammed into a guardrail. It seemed like there were no serious injuries than some scrapes and a pain in my back. I was transported to the ER anyway. They did an x-ray, told me I had bruised muscle, and attempted to send me on my way. Except when I sat up I couldn't lift my ass up to put on my pants before stepping off the gurney because my back hurt so bad. They run another x-ray, do an MRI, and a few minutes later the room is flooded with doctors and nurses. I had a fracture dislocation of vertebrae T2, T8. Basically my spine was in half and parallel to itself. On top of this, they missed the fact that my lung had collapsed and was filling with blood. Hemopneumothorax. They had never seen someone like this who could still walk. I had basically won the medical equivalent of the lottery that day. I was life flighted to a level 1 hospital in my state and 5 hours later had 14 inches of titanium put in my back. I was only in the hospital for 9 days and required no rehab. Edit. Here's the MRI, here's me now. No loss of any functions, thankfully. 400th edit. A medical professional has informed me that these are CT scans and not MRIs. Sorry, it was early when I posted, and I was of the dumb. 401th, and I lost 6 liters of blood. Thanks blood donors. 402nd. Hi Matt. I love you. Link to the photos will be in the description if you are interested. Not me, not a doctor. A friend who is the definition of anti-establishment, anti-vax, anti-anything science-backed always had a little bump on her nose. She put her oils on it, smudged with sage to remove the toxins, and regarded it as her beautiful bump. The bump gets bigger, darker. Her grandmother supposedly tricks her into going to the doc about it. I think she was supposed to be helping grandma to her own appointment, but sneaky grandma had other plans. Anyway, Miss Oil's cure everything is currently in hospital, having the entire left side of her nostril and part of her cheek removed due to skin cancer. Thank you for watching Internet's Funniest. Please like, share, and subscribe. Come back tomorrow for part 2.